Recently, the Works and Transport Minister, General Katumba Wamala, launched a collection of road toll fees for the Kampala-Entebbe Expressway, a major and quicker gateway to the country's only international airport. While launching the toll fees, the minister revealed that fees collected will be used to finance the loan, while the rest will be used on operation expenditure, such as security along the road, ambulance and breakdown services, and routine road maintenance.
I think that will make us even value these assets, because there's been this feeling that we are government. But now that we are paying something, I think we shall also be very, very guarded and ensure that there's no damage on our assets.
On the same note, today doctors under their umbrella body, the Uganda Medical Association, commended government for the great initiative, but are requesting government to be exempted from paying the fees.
So we are requesting the same spirit, please. Let doctors who are basically have identified themselves as doctors and only as doctors to be allowed to use the express highway, because what we deal with is life. I might be called to go and save a life, and when actually the only thing I have in my hands are the car keys. So you will stop a doctor and lives will be going. Can you allow doctors to access the express highway? It will be good for the economy and it will be good for the patient.
In case of any medical emergencies, health professionals are expected to be traveling or using an ambulance, because as you may know, the Roads Act allows for 3 exemptions. That is the convoy of the President of Uganda, fire brigade trucks and ambulances. So those are the only exemptions. So if anybody is undertaking a medical emergency or medical evacuation, they are required to use an ambulance, and that is the only moment of time when they will be exempted from paying toll fees on the Kampala-Entebbe Expressway.
The 51-kilometer road is the country's most expensive highway, constructing at $350 million loan from Exim Bank of China. On the other hand, medical doctors are calling all actors in the private sector to follow the government's lead in making sure that medical doctors and health workers doing similar levels work in the private sector are paid similarly or higher.
Since the government is now prioritizing on revamping the economy and health, can we please implement what is left to be implemented to the health workers? We are saying as doctors, because doctors are the heads in the health workforce. Doctors lead patient care and they give directions on patient management. So we expect even the colleagues they work with, the nurses, the labs, clinical officers, to also be directly benefiting when a doctor's increment is made. So these colleagues must also benefit. So we are saying the entire workforce, let's revamp the entire workforce.
On the COVID-19 pandemic, where Ugandans, including health workers, have been affected with a recipient peak infection rate of 23%, doctors have asked the public to go for vaccination and follow the SOPs.
Get vaccinated. Get vaccinated. But when you have clinical symptoms of COVID-19, stop self-medication. Get to health facilities as fast as possible. Be assessed. Let doctors assess you, because we have what we call euphoric oxygen saturation, which is presumed to be normal by patient. Someone is working with oxygen saturation of 80%. And when you reach 60%, you will collapse. So we are saying, please, you better go to a health facility. We assess you generally. We know your state. Don't say me, I'm strong, and then in the night I had difficulty in breathing a little bit, but in the morning I'm okay. My friend, you will collapse and die.
Medical workers under the Uganda Medical Association have continued to appeal to government to minimize on the deductions being made on the payments they receive, which they say have been unfair. Shamim Natebwa, CTV PM Edition.
You take a picture.